Hi, everyone. Hello, happy Wednesday. Good afternoon from Toronto. Dr. Amin here. Nice to have you all here. So, today we have a privilege speaking with Dr. Doris Day, one of the most respected voices in dermatology and world-renowned dermatologist who help many people to gain confidence in their skin. So if you have any questions about skin health, about your skin changes, hair, all of those great questions, do not hesitate to drop it here in the comments. And if we had a chance, we're going to answer some of those questions. And so it's interesting that Dr. Doris Day not only treats skin, but she understands how our hormones, environment, our lifestyle, and even emotions can leave their mark on our skin. So I'm going to invite Dr. Doris now in a second. And as I said, if you had any questions, definitely drop it here. In a second, and as I ah,
Hi, how are you?
I'm good, thanks. How are you? Lovely to
Good.
have you here finally.
I know, it's so good to be on with you. I was trying to do it from my computer, but it wasn't working, so I'm doing it from my cell.
Great to have you here. It's an honor. It's amazing to finally have you here. And I love your posts and educational videos on Instagram. I always follow your tips, and it's just amazing.
Thank you. I love following you too.
Thank
Always
you.
learn.
Thank you. Great to have you here. So, Dr. Doris, I know you don't have that much time, but so we just dive into some questions about changes of the skin, especially in midlife, perimenopause, and menopause women. So I received some questions, and first of all, how much of the aging in midlife is related to hormones, and how much versus aging only?
Yeah, I generally say that only about 80%, only really about 20%, let's go the other way, of how you age is genetic. So you have control over about 80% of how you age, and maybe even 90% of how your skin ages. And once you hit perimenopause, what happens is genetics starts to kick in a little bit more. And certainly as we get older, it's more about genetics than about lifestyle, because lifestyle has already sort of added up and then your genetics show. So when you hit perimenopause, what I notice is that patients will come in and they'll start complaining about things that they didn't notice before. They'll come in and they'll say, one day my face just fell apart, or why am I breaking out now? I haven't broken out in years. Or my skin is dry and itchy. They'll notice all of these changes in their face and in their body and in their neck, really all over, that kind of creep up all of a sudden. But these have been years in the works, and that estrogen decline has really had an impact in accelerating that aging process. So, what I focus on a lot now is when I see patients who come in their 40s, even sometimes late 30s, and I've known them for a long time, many times, and I start to have the conversation with them about doing menopause hormone therapy, which is now what we call it. We used to call it hormone replacement therapy, but now we call it menopause hormone therapy. And a lot of the conversation is around how safe this is, how effective it is. And I'm not saying it's for absolutely everybody, but the conversation is for everybody. And where I see the biggest problem is when women say, my doctor said it's not for me because I have a family history of breast cancer, or I have a clotting factor, or I get migraines. Hormone replacement or menopause hormone therapy is topical. It goes through the skin, not through the mouth. And that changes how it's absorbed, how it's affected, how effective it is. And it's about oftentimes 10 times less concentrated than or less potent than contraceptive, hormonal contraceptives. So women will be taking hormonal contraceptive for 20 years and not think about it, but they won't do hormone therapy. It makes no sense. So a lot of what we have to do is help women understand the power and the importance of understanding that while your body stops making estrogen at a certain age, or the estrogen declines, your body doesn't stop needing it. And it doesn't just affect your skin, it affects your brain and your joints and your gut and your bones, and your heart. The number one killer of women after menopause is heart disease, and estrogen helps against that. So when I help their skin, they come back and they say, oh my God, I feel better. I sleep better. I think better. Everything is better. So being a dermatologist is really a very critical position, because we don't just help our patients look better, we help them be better in so many ways, and it's really rewarding.
Amazing.
Mhm.
So your approach is very holistic, which is great. Make more sense.
Yeah, you're exactly right. It's very, very holistic, and it's often minimalist. And one of the things that I see that happens is that the bone structure ages. So part of this aging process is that people start to see more lines and wrinkles. But what we have to understand is that it goes beyond the skin itself. And unless we understand the structural changes that happen, if we're just chasing wrinkles and trying to freeze the whole face, we're not going to help that person look better or age better. We're only going to fill lines and wrinkles. And that's when you end up with that overfilled look or the unnatural look. So it's really understanding the aging process, how it changes with time and hormone changes, and then how we can affect the structure, not just the superficial changes.
Absolutely. Absolutely. How can we now slow down this process? Of course, this is inevitable and it's aging is something natural, but how to slow it down? What are your recommendations normally to people with especially skin and hair?
So when it comes to the skin directly, the number one best way is to be sun smart. I know it's not sexy. I know it's not always easy for people and doesn't make people happy to hear, but the reality is that 90% of how your skin ages is from UV radiation, and the rest is pollution, stress, diet, things like that. But just being sun smart. And sun smart doesn't just mean using sunscreen. It means trying to not tan. It's going with your own glow, trying to keep your skin color at its natural tone. And that means applying SPF, reapplying regularly, wearing a hat, sunglasses, sun protective clothing, staying in the shade in the middle of the day, doing your activities earlier and later in the day. I mean, I think sun is great for you. It's great for your mood. It's great for your energy levels. It's great for hormones. It's great for so many things. But it doesn't mean that you should get as much sun as possible. It means you have to be smart about it and get early morning sunlight. That helps your circadian rhythm. It's good for your eyes. It's actually even good for your skin when the UV index is below 3. But then when it starts to go up, you have to be smart. And look at your skin. If your skin shows signs of damage and aging and burning, that's too much for you. Everybody needs different amounts. I have a few patients who get so much sun and they're just fine, but they're the exceptions. Most of us need to be more careful. Then it comes down to also doing things like getting enough sleep, because your body and your skin repairs while you sleep. Getting quality sleep is really important. And then staying hydrated matters. You have hyaluronic acid in your skin. Hydrating your skin from the inside and the outside helps. Supplements, I think vitamin D with K is important. Magnesium glycinate and magnesium L-threonate are important. As you get older, adding some creatine and getting enough protein is important, all for your skin, but also your body. Exercise, we know that doing things like resistance training and some cardio is really good for the collagen production of your skin. So just doing weightlifting really, really helps. Now, as you'll find, all of these things I'm talking about that help your skin naturally also help your brain, they help your body. So your skin is not just a reflection of how you're aging, but it also affects how you're aging. So if you take great care of your skin, your other organs will age better as well. and it's a beautiful thing. And that's why we have to be holistic. So it's both lifestyle, but because your skin is on the outside and it's exposed to the elements, you have to affect your skin directly as well.
Great, amazing advice. I think everyone have to follow this. And so, of course, so sunscreen, the first. What else with the cream wise? I mean, I have patients coming and asking me about different brands. Doctor, I mean, when to start, how early? I have twins myself, teenagers now this year,
How
13.
fun.
So, and they see these TikTok programs, so many different products. Mommy, let's buy this and that. So, what is, as a dermatologist, your recommendation? What are the earliest time to start and what products?
Well, in the teenage years and even younger, I think it is good to get into a good skincare habit. Unfortunately, teenagers kind of go overboard and it becomes a little competitive with them where they go to Sephora and they buy things that they don't need. I had an 8-year-old I saw and she had so many products and I just asked her what she was using them for. I didn't say to use them or not use them, but I said, what are your goals in using this product? What are we trying to accomplish? Because then I can help direct you in what you're using. And she said, well, I want to avoid wrinkles. The child was 8 years old, and she wanted to avoid wrinkles. So we had a conversation. I take them very seriously. I don't make fun ever, but it was adorable and also a little sad because I also told her wrinkles don't make people old. And I think wrinkles can be beautiful. So it's resetting how we see our younger generation, how they see the aging process. And it's so interesting because I feel like we're living longer, right? We're learning how to live longer. We're into longevity, but everybody's worried about looking older at a younger age. So in some ways, we're accelerating all the things that we're doing and we're missing the point and we're missing the boat. So in my teenage patients, I get them into a good, healthy skin routine. And I like products like Neutrogena Hydro Boost or Laneige. Those are, or Skin Fix. There's some really nice products that have gentle products that are minimal in terms of their ingredients. But at 12, 13, your girls are starting to go through hormonal changes. They can break out a little bit. So I never judge anyone. I agree with Ross Alloway. Never judge our patients or our young ones that come in or anybody really, just there to help and redirect them. But it's really a matter of helping them understand what's really good for their skin and how to protect. And I tell my younger patients all the time, I tell them, put sunscreen on your neck and always go in an upward direction because when you're 60, you may not remember my name, but you'll remember. And recently I had a patient who came in and I said, oh my God, your neck is so beautiful. It's pristine. And she said, yes, because you told me 20 years ago to protect my neck. And I listened and I was so proud because it really does work. If you protect the skin of your face and especially your neck from a young age, from sun exposure, it will age better. So in the young patients, it's a good skincare routine: cleansing, moisturizing, sun protection, gentle exfoliation, and that's it. As you get older, then we start adding in things like retinol and retinoids, which do help with collagen production. Now, there's a myth about these that they can make your skin thinner. The reality is they actually build collagen in your skin and they help keep your skin young. I like peptides and exosomes that can really help as well. Somebody is asking for a review on CeraVe. I love CeraVe as a brand. Actually, they have a new shampoo that I did a lot of advisory work on, and I think that shampoo is actually fantastic. They have a shampoo, a gentle shampoo, and then one for dandruff, and they're both excellent. And CeraVe is known for both having ceramides, which is natural to the skin and a great hydrator. And it also is known for minimizing things that people might be allergic or reactive to. So it's a great brand, especially if you have skin allergies or if you have issues that way. But then again, as we get into the aging process, I do like an eye cream that has retinol. And sometimes it's fine to use the same product on the face around the eyes, but many times I prefer an eye cream for the eyes because it's specifically tested for the eye area. And I think that's a good thing to have. Hair aging can get worse around perimenopause and menopause. And if you're prone to hair loss, then it can accelerate a female pattern of hair loss. So see your dermatologist, make sure that you have a non-scarring pattern, because the difference between the different types of hair loss, there's two main categories, scarring and non-scarring. And if you have the scarring pattern, that means that the follicles are lost and that hair won't grow back. But there's a lot we can do to both protect it from getting worse and to help as much of the hair that can grow back that's not fully scarred yet grow back. So you need to see a dermatologist for that. And then things like topical minoxidil are FDA approved and they're available over the counter without a prescription. Um, and Diane is asking about estrogen cream
That's
for the
true. Yeah.
face. Yeah.
Hmm.
So estrogen cream for the face, I'm actually just starting a clinical trial on one in a few weeks, so I will have more data. I know Alloy makes one. They've done some studies. Now, what I've learned from all the research that I've done is that you have estrogen is a hormone. The way hormones work is that they have to bind to a receptor. Think of a ship binding, stopping at a docking station, and then you unload the goods that have the effect. So estrogen has to bind to an estrogen receptor. Now, there's two kinds of estrogen receptor, alpha and beta. The alpha receptors are in your breast and reproductive tissues, but the type of receptor in the skin is called the estrogen beta receptor. So it's a completely different receptor. When you apply an estrogen cream, whether it's estriol or estradiol, these are both bioidentical. Estriol is just much weaker. You get the upregulation, those receptors will now grab that estrogen, and you don't get the effect as if you took it by mouth. So all the data that I've seen is that by using estrogen cream on the face, plus the concentrations are very low, it's safe, it stays on the skin. The part that I'm kind of waiting to see, and I'll see what my study shows when I get through it, and I'll share it with you when I get there, is does it really make a difference? And it may make a difference, but maybe not by itself. It may make a difference if you combine it with a retinol or with other ingredients and products. So the estrogen cream, I think, is safe for most people. You always speak to your doctor, but I don't have many concerns about it, especially in the concentrations that are used. But also just know that there is no FDA approved estrogen cream that's for the skin. There's one that's approved for vaginal. And I really think that all women in perimenopause, even if they've had breast cancer, should consider vaginal estrogen, because the vaginal lining gets thinner, and not only does it make sex painful and uncomfortable, but also it increases your risk of urinary tract infections. And just by adding local vaginal estrogen, and it's so easy to do, you lower that risk, and the morbidity and mortality of urinary tract infections can go pretty high. So it's just such an easy thing to do, and it's safe. And I know that a bunch of really smart doctors are trying to negotiate with the FDA to get those boxed warnings off. I think it could probably even be over the counter. But many people use that vaginal one on their face, and we just don't know about the absorption or if it actually does anything. So more studies are being done, but in the meantime, I don't object to patients who use it. And I just think it just should be used with other products that are going to improve your collagen, not just by itself. So I don't think by itself it would do a lot, but I think in combination with other things, it would do a lot.
Amazing. A few questions here I see about rosacea. There have some questions if it's safe to use anti-aging and what is rosacea. So a little bit to touch on that,
Yep.
please.
So rosacea is an inflammatory condition where you see there's different types of rosacea. Some types of rosacea, you just see redness, and that's annoying. Some types of rosacea, you get a breakout that looks like pimples, but without the blackheads and whiteheads, just the pustules and the papules. There's a type of rosacea that affects the eyes. That's ocular rosacea, and it feels like a gritty feeling in the eyes. And then the last type is rhinophyma, which is a bulbous full nose, like you think of W.C. Fields. That seems to be most related to alcohol. Now, rosacea is not bacterial. There's no, like acne, we think of a bacteria that's overgrowing or behaving pathologically, although there's some new things about acne that's come up. But rosacea tends to be more inflammatory. And what we find is that if we use sulfa-based medicines or antiparasitics like topical ivermectin or topical metronidazole, that seems to calm the rosacea down. What I've learned is that by adjusting the skin microbiome, those are the microbes, the bugs that live in the skin, you can really make a big difference in both acne and rosacea. And there's a product called BioJuve that's a topical skin probiotic that does really, really well for that. La Roche-Posay has some good prebiotic products that help as well, but I think BioJuve is exceptional in this regard. And I use that a lot in my office. So actually, I wrote a book with a guy who came up with the microbes that are in BioJuve. It's called Rebooting the Biome, and it's all about the skin microbiome and how if you balance that out well, you age better. But as we age, our skin microbiome changes a little bit, and that can make you more prone to rosacea. That's why we don't see rosacea so much in children. And many times people will come in and they say, I didn't have acne, I didn't have rosacea as a kid. Why am I getting it now? Well, some things happen in adulthood. So we have to address them as they come up in adulthood. So I use BioJuve for acne and rosacea because it's balancing out the skin biome and helping with both conditions. So I use it in just general healthy skin that wants to age well, and I use it specifically in both acne and in rosacea as well. In acne, it's helping reset the bacteria in the skin. In rosacea, it's helping to control the Demodex, the mites that are in the skin that tend to overgrow in people who have rosacea. But other things you can do for rosacea is know what triggers it for you. So the triggers for rosacea are stress. Okay, who doesn't have stress? But I always say you can't not have stress, but it's how you manage the stress. As you get older, you just have to say, listen, I've been through stress. I'll get through it. I'll be fine. And look at things as a puzzle, not as the end of the world. Just looking and managing stress differently can help that stress reduction and can help rosacea. Minimizing alcohol is a very, very big deal for rosacea. So if you can quit alcohol for a while, see how it helps your rosacea. And then some spices and some foods, everybody has their own personal triggers. Mine was vinegar. So once I stopped adding vinegar to my food, my rosacea got so much better. And now I can have some vinegar sometimes and I'm fine. So everybody can figure out what their own personal triggers. So it's stress, alcohol, extremes in temperature, and some spices.
Great. I mean, it makes sense with significant decline in estrogen. We see all the flora changes in gut microbiome, in vagina and skin. So you're absolutely right regarding using the products for balancing the flora.
Yes, I
It
agree.
makes
And I often
sense.
recommend gut probiotics to take by mouth as well.
That's great. A lot of questions about Botox and fillers. Any recommendations on that? Where to use it, when to start, and how?
So I don't really think of an age to start. I look at how somebody moves. And I think the beauty of where we've come with these products is we've learned to finesse. So when products first come to market, we often find that we can freeze everything or expand everything to the max and we get so excited. And then over time we kind of learn that no, we don't need to do that. We can finesse with it. So I think when Botox, or now we have 5 different products or maybe 6. We have Botox, Dysport, Daxxify, Jeuveau, Latibo, and Xeomin. So that's a lot of products available. They're all a little bit different. I use all of them. I like all of them. And if you do it correctly, you can balance out movement. So if you understand where the wrinkle is coming from, and I often give the example of forehead lines. So I can fully move my forehead, but I've learned to lift my ears instead. I don't know if you can see my ears go up,
Yeah.
but so when I lift my ears, it gives me the same effect as if I was lifting my brows without making forehead lines. So what I try to do with Botox, or the one that I use, is I try to help relax overused muscle to redirect the movement in a more positive way. But the forehead muscle is really the only elevator of your brows. So when you inject the forehead, you're always eventually going to drop the brows because you're eliminating the ability to lift them. And that's going to make somebody feel heavy, and it will help them age faster because you're going to thin that muscle. So you have to be very careful. If I do Botox in the forehead, it's to even out the brows or to soften the deepest part of a very deep muscle or line from that movement, but it's not to eliminate all the movement. Between the eyes, the glabella is different than the forehead. This muscle or group of muscles is pulling in and down. So when you inject here, you get a lift, and that's a good look. Here, you can open the eyes, but if you go too low, you're going to drop the smile. So knowing anatomy, using the right product in the right amount in the right way makes a very big difference. And you just have to learn over time and just be careful of how it's done. They all last about 3 to 4 months. Now, with filler, there's been so much of an argument over what fillers can do. So people go in and they come in and they go, can you just put filler here so it lifts? Well, the reality is that fillers don't really lift, they fill. But fillers can fill in two ways. They can fill a line, or they can actually act in a structural way. So when I put a filler on the bone on the lateral cheek, it is actually creating the effect of a lift because it's helping support the bone and that structure. So if somebody is too full in front, if you feel a little bit behind, you just have to put it in the right spot, because if you go too high, then it doesn't look good either. You have to hit where's right for them. You can give a lifting effect, but it's not actually a lift. Only a facelift lifts. And then if you go on the gonial angle, because people lose muscle, they lose fat in this fat pad in front of the ear, you can actually create a lifting effect by building out where the structure should be. So it's understanding both volume loss and structural changes and helping to restore structure that will help you not look like you've been overfilled. Now, when somebody has upper lip lines, oftentimes they just go that and try to fill the lines. But the reality is most upper lip lines come from volume loss in the chin and the lower lip. So before you fill here, you need to look at the chin, because this bone recedes and shrinks back. So it's only by fixing this part, then the upper lip will naturally repair itself, or you could do lasers or put in a very little of a very soft filler. I like Redensity. Now, somebody asked if fillers never go away. And the answer is they usually go away, but not in the time frame that we used to say. So when a product does a clinical trial, when a company comes out with a new filler, they'll do the trial for 6 months to 2 years generally. And once they end their study, that's what they can make the claim for. So the problem is that products will then say, okay, this lasts 2 years or 6 months or whatever the end of the study was. But when we look, whether it's with ultrasound or just look at people's before and afters, they're still filled. So I never put patients on a schedule to get filler. I put them on a schedule for evaluation, but many times they'll come in and they don't need more. And the problem is a lot of companies, when they train, they go, well, you can always put a syringe somewhere. And no, you cannot. You shouldn't. You may, but you shouldn't. So it's understanding that the person you're going to will say no if you don't need more, or will understand what your face needs and how long the filler is lasting in you. Different people metabolize it at different rates, and we have to evaluate that. I actually was one of the sites for the first FDA trial in the US for the first filler in the US, which was Restylane about 25 years ago. And when I saw patients back, even 15 years later, because we only did nasolabial folds at that time, some of them still didn't need filler. 15 years later, under the eye, fillers can last 10 to 15 years. And now we know that fillers have lifespans in their own way. They can age also. So when you put a filler in, it can look very different 2 years, 3 years, 4 years after, as it starts to break down. Many of them, as they start to break down, will become more water absorbing, and they can swell a little bit. So especially around the eyes, because that's such a delicate area. So a lot of times too much filler is put under the eyes, it's reapplied too often, and then as the filler starts to break down, it looks bluish and swollen and not at all attractive. So we have to understand the fillers have their own style. Each filler behaves a little bit differently. I'm very particular about what I use in different parts of the face, and I won't just say, oh, I'm doing fillers here, I'll just put a little bit of it there. If it's not the right filler, that's not the way to do it. So you have to understand structure, anatomy, ligaments, fat, aging of the face, that person's specific metabolism, and then treat them accordingly. But always be willing to take a step back and say, not this time.
Absolutely. I see so many complications. So please, please, everyone, see someone who knows and has the expertise. It's very important. And some about lasers. So many laser, different types of lasers, especially for the neck area. I see many patients who, since using especially GLP-1 medications, losing a lot of muscles in the face and neck area. They come complaining now. We have this droopy and loose skin in the neck area. So any recommendations how to prevent or help them with that issue?
Yeah, it's such a great question and such a great point, because I think that using devices, lasers and non-laser devices is as important as fillers and neuromodulators. So I have my favorites. I think SoftWave for me has been such a game changer in how patients age. We love it for the neck and the face. It doesn't melt fat, but it does help build the skin, and it does tighten and give a lifting effect. And that lifting effect comes from improved collagen in the skin and more resilient skin. But patients come back consistently and they say, this really works. So SoftWave is one of my go-to devices, and it's great because you could do it in the summer and it doesn't have downtime. And you can do it on the neck as well, on the jawline. So we'll just have patients come in. You could pick parts of the face or do the whole face. And it's also really, really great around the eyes. Now, I do laser resurfacing on the neck, but you have to be careful. Your neck doesn't have oil glands, and it doesn't always heal as well as the face, or actually doesn't heal as well as the face. So you have to be a lot more gentle on the neck. So for the neck, I use retinols. I use laser resurfacing, sometimes a thulium laser. I like the M-Joule, the Moxie BBL. And I do the CO2, but very gently when I do the face as well. And then you have to understand it has to be done several times. It's not one and done. And so it can take several visits. It can have more downtime, but it can work. And then just be really, really good about protecting your neck skin from the sun, because that's what accelerates aging more than anything. But it's a complicated area. And sometimes if it's bad enough, it really is just surgical. But even with surgical approaches, if your skin quality isn't good, you still need the devices and the lasers and the products, because you want to improve the thickness of the skin itself. If you pull skin tight and it's not good quality skin, it just looks like pulled old skin. So you have to try to improve the skin quality.
And one last question about spots, pigmentation, how to, it's very hard, I know, but any way to remove them, especially midlife?
I tend to not treat spots individually, but to treat the whole area, because it's very hard to match just the product to one spot and not get a ring of light or dark around it. So I tend to treat the whole face, not just a spot. Now, depending if that sunspot is melasma, which is from hormones and heat and sun, I don't tend to use heat-based devices for that. I'll use more chemical peels. And melasma comes with pregnancy, but also if you're on the pill for a long time, and it's more reticular, it's more patchy than just sun damage. If it's really just post-inflammatory, so after acne or a mark that's left behind, and actual sunspots like lentigos from the sun, which are sun damaged spots, then CO2 resurfacing is amazing. Broadband light is great, and thulium laser is great. So, and I have the Phytona, which is an erbium YAG laser, which is amazing too. So there's a lot you can do. Chemical peels can help as well. So there's a lot you can do. over the counter, there's a product called Cispera that's really good that you can get from your dermatologist. There's tranexamic acid, which is also good topically, and there's also an oral version, which I use for melasma. So there's a lot you can do for discoloration, but the main thing is if you're prone to it, and one way you can know if you're prone to it is if you look at the crease of your palm. If the crease of your palm tends to get a little bit darker, that means you're more prone to pigmentation. So, mine are the same color as my skin, so I'm not as prone to the pigmentation. But I look at my patients before I do treatments, and I can tell who might have a harder time with pigmentation issues after, and try to help them that way.
One last question. I know you have to go and leave
Yes,
us, but someone is asking about if Profilo is the same as filler.
yeah, so Profilo, we don't have it in the US. I've had patients come from Europe and tell me they're happy with it. So it is hyaluronic acid, but it's a bunch of different things. It's cross-linked, uncross-linked, and it's meant to be a hydrator. But in the end, it is hyaluronic acid, which is also in fillers. And I haven't used it here, but I have heard pretty good things about it. I don't think it'll get FDA approved in the US because there's more than one ingredient in it, and the FDA would make them test every ingredient separately before they use the combination. It's a complicated FDA process, but my patients in Europe seem to generally like it as a hydrator, and so not so much as a filler. So it's kind of thought of as a skin booster, but you can still react to it.
That's great. Thank you. Thanks. Great. Any advice, piece of advice before you leave us for the
Yes,
audience?
I would say when you look in the mirror, before you go to criticize and say, oh, I don't like this or that, try to say something nice. Try to see your beauty and see what you love about how you look. Is it your eyes? Is it the way your hair frames your face or your bone structure? But just remember, we all have beauty. And before we start trying to address things, we want to go from beautiful to more beautiful and to appreciate the beauty that we have.
Amazing, lovely. It was amazing to have you, and I will share this. A lot of people ask about this. Definitely, this session will be saved, and I will share it with everyone here.
Thank you.
Thank
Thanks
you,
for,
Dr.
for doing
Doris.
this. I
That
love
was
talking to you.
amazing. I loved it.
Thanks.
Amazing. Thank you very much, and thanks everyone for being here with us.
Thanks,
Have a
everyone.
great day. Bye-bye.
Bye.
Bye.
Bye.